Miss South Africa 2020 Shudufhadzo Musida will be launching her online mental health initiative called #Mindful Mondays live on Instagram on Mondays at 7 p.m. She announced that she will be focusing on raising awareness around mental health when she took on her crown last year in October. The program, hosted in conjunction with the South African Depression and Anxiety Group, will speak to various experts on a diverse range of topics related to the subject. She joins us this morning to share more on her campaign. Shudu, a very good morning to you. Thanks for joining us. Welcome to Morning Live.
Morning. Thank you so much for having me.
It's such a pleasure having you join us this morning, Shudu. Why is mental health a topic so close to your heart?
Mental health is a topic close to my heart because it's one that's often ignored. But if you look at the stats, it's quite alarming if 1 in 3 people are expected to suffer from mental health in their lifetime, with suicide being the leading cause and sometimes at least second leading cause in some places of death amongst the youth 15 to 29. So when I read those stats, plus also just being a person who's suffered with being anxious in matric and experienced mental health in some degree sometimes, I thought it was important for us to start this conversation, to let people know that it's okay to not be okay, to know that they have a safe space where they can come in and learn, because most of the time, the thing about mental health, none of us know enough about it in order to learn about it, in order to destigmatize it and remove the taboo stigma around it. So it was quite an important conversation for me to start.
Okay, and with these Instagram live chats, what are you hoping to achieve, Shudu?
Basically, the whole point of it for me is to educate as a means to inform how we as a society view mental health. So most of the time, even something as simple as the language that we use, we often use words like "you're so crazy," "you're so bipolar," "you're so this," so loosely. That's an example of it. But then moreover, just to learn more about mental health, to realize that it's as important as physical health, because we can't have physical health without having mental health.
Yes.
So this program is just to emphasize that and to educate people and to help us learn, including myself, to help us learn more about mental health and just how we view it and to destigmatize it essentially.
Well, I understand that you've got guests lined up for each topic. So how will this play out?
So every single Monday, we're going to have the guests come in to discuss various topics. Our first guest is going to be announced tomorrow. They're going to join in either from the same vicinity that I am, but just because of COVID as well, I think it's best. What we are planning is that they join from wherever they are, and then we record that for people to see on live. But then we're also going to save the videos on the Miss SA page and other various platforms as well, just so people can have access to the information, not just for the 7 p.m. So technically, what's going to happen is that they're going to join from wherever they are. I'm going to be where I am, and then we're going to discuss the various topics and have a conversation about it.
Will you be giving people an opportunity to interact perhaps and ask questions during the talks?
Yes. So on the Instagram Live, we are going to do 40 minutes where we just speak, and then we're going to save a bit of time for questions as well. But
yes.
Moreover and above than that, I have already asked people on Instagram to send me a list of topics and a list of questions that they'd like me to ask the clinical psychologist I'm going to be speaking to on Monday. So we're going to do that almost every other day, where I post, if you have any questions, if you watch the live, if you have any questions, please just let us know. But someone from SADC as well during the live will be monitoring the questions, monitoring the comments to see which questions we should answer and how they can come in to help.
We certainly cannot overemphasize the importance of these discussions, Shudu, but with so much inequalities in South Africa, how will this reach a broader audience? Because not everyone has got access to Instagram.
Well, that's a question I've been getting a lot, and I do understand, because I come from a rural area where there might not be even network for it just to even get onto Instagram. But then I believe that we need to start somewhere. I believe this is going to be bigger than what it is, and then we're going to be able to reach wider audiences. But we have to start somewhere, because the inequalities in this country, yes, are glaring. And this is one of those platforms where everyone needs to be able to access it and see it. Hence the importance of just making sure that it's accessible on different platforms, even after the live. So the SA page and maybe a few other pages, including SADC, where they can access it. But other than that, we can only hope that it grows enough so it can reach wider audiences.
Shudu, it's estimated that about 75% of people with a mental disorder do not receive mental health, health services, often referred to as the mental health treatment gap. Insofar as engaging the government and as a public figure yourself and as a person of your stature, do you think this is one area of our healthcare system that has been largely neglected by our health authorities? And if so, how would you be able to, lend your voice insofar as making sure that this is not the case?
Definitely, it's been overlooked for so many years. If you look at the budget, I think, if I'm not mistaken, don't quote me, it's 5% of the national health budget goes to mental health. That means it's for institutions, and they don't even fund institutions such as SADC. So SADC has to self-fund in order to sustain themselves, and they're doing such a great job at providing resources, at least, to help people that are suffering from mental health or that are suicidal or that need someone to talk to. I think in terms of engaging government, it starts with conversations like these, the conversations like Mindful Mondays, where they realize the importance of mental health. When I won, a lot of government departments were very much interested in seeing how they can get involved. So with Mindful Monday starting, I'm hoping that the involvement will be as they said, and it's gonna help shine the light more on mental health to show that it's as important as physical health.
Just moving forward, how do you wish this campaign will grow?
I'm hoping that it grows to the point where we tap into different platforms. So not just Instagram. If there's a way that someone that does not have a TV but has a radio can access this, I'm hoping that there can be a way for that to happen. If there's someone that has a TV and there's a way for them to access it, I'm hoping that can happen, because for now we can just start somewhere. If we talk about how we can't start because of this and this and that, we'll never get anywhere. So it's just better to start where we can and just hope that it grows into something bigger where more people have access to it. More topics will be discussed, more people learn. I think my biggest thing is for people to learn and to be educated about it, because once you do that, we're on the right track to destigmatizing mental health. So yeah, I'm hoping that it grows in that regard.
Shudu, it's always a pleasure chatting to you, and we certainly hope that these are the kinds of conversations that we should be having. And thank you so much for lending your voice to this often neglected area of our public health. We appreciate your time.
Well, thank you so much for having me.